All right, so welcome to another deep dive. We always appreciate it when you all send us these interesting materials.
Definitely.
And this time we're looking at some ethical guidelines that psychologists follow, and especially when you're thinking about starting therapy, pausing it, maybe taking a break or ending it.
hmm
What are the things that they think about on their end?
Right. Like from their perspective, exactly.
Yeah, so we can kind of get a view into that side of things.
Yeah. And it might help someone, considering therapy or who's already in therapy kind of know what to expect.
Yeah, absolutely.
Huh.
So let's just jump right in. We're looking at interruption of services first, and we've got standard 3.12 and 10.09 here, which really emphasize a psychologist's responsibility to plan for continued care.
Mm.
Now, this can be because of something on their end or on the client's end.
Right. And it's really fascinating because it's not just about having a backup plan, right? It's like a commitment to your well-being
Oh, yeah.
to make sure that therapy isn't, completely derailed as something unexpected happens. Like if a therapist gets sick or, a client has to move or something like that.
Absolutely.
And these standards, by the way, are specific parts of this larger ethical code that guides their professional responsibility.
Right. So for you, the listener, this basically means that even if something comes up, something unexpected, there should always be a plan for how your therapy can continue
Exactly.
without, a huge disruption.
Mhm.
And it shows how important it is for the psychologist to be thinking about your needs, even when their own circumstances might be changing.
Yeah.
And then there's another point here that if a psychologist's, job or contract ends,
Right.
they have this ethical obligation to prioritize your care and try to make that transition to somebody else as smooth as possible.
Absolutely. So you're not just left hanging.
Yeah, exactly. So moving on to actually ending therapy altogether, standard 10.10a is really interesting because it says the goal is for therapy to end when you no longer need it or you're not likely to benefit anymore, or if continuing might even be harmful.
Yeah, that makes a lot of sense, right?
Yeah, it's not supposed to just go on forever.
Yeah.
And they even give some examples here, like when you've reached your goals or if you know it becomes clear that whatever approach you're using isn't really helping.
Right. And standard 10.10c is
Mhm.
is really key here too, because it says that in most cases, psychologists should offer what they call pre-termination counseling
Oh, that's interesting.
and try to help you find other providers if you need them.
So it's not just like, okay, bye.
No, no, it's much more thoughtful than that. It's
Yeah.
about, ending well and
Yeah.
having that process be deliberate and considered.
Yeah, and making sure you're taken care of,
Exactly.
even after you're done seeing that particular therapist.
Absolutely.
So very interesting. And of course, like with anything, there are some exceptions. And standard 10.radon-B talks about a situation where a client or someone close to them actually poses a threat to the psychologist.
Yeah, that's a serious situation.
Yeah, and in that case, immediate termination is allowed.
Right, because the psychologist's safety is also really important.
Oh, yeah, absolutely.
And, in those cases, they don't have to give, the usual advance notice
Yeah,
or the pre-termination support.
it's a totally different protocol.
Yeah, it's a totally different situation where immediate action might be needed for their protection.
Right, and just to be super clear, what we've been talking about here, these are the ethical guidelines that psychologists themselves are held to.
Exactly, as outlined in these materials that you all sent in.
Exactly. And we're really just focusing on understanding, what these standards mean.
Right. So to kind of recap what we've talked about, we've covered the responsibility to plan for interruptions. We've
Hmm.
talked about the appropriate ways to end therapy.
Based on, your benefit or lack thereof.
Right. And we've also touched on the exception for when there's a threat to the psychologist.
Exactly. And I think the biggest takeaway for me is that understanding all of this can be really empowering.
Absolutely.
Gives you this insight into what you can expect from your therapist, especially when it comes to the, continuation and conclusion of your care.
Right. And it makes you realize that you can have a say in that process.
Yeah, you're not just along for the ride.
Exactly. So it raises a question that I think is really important.
Oh, yeah.
How might knowing all of these ethical guidelines,
Yeah.
Change the questions that you ask your therapist
Oh, that's good.
or the conversations that you have with them about, where therapy is going and how it might eventually end?
Yeah, how might it make you feel more comfortable?
Exactly. And what does this tell you about how collaborative therapy can be?
Oh, I like that a lot.
Yeah. So thanks for exploring this with us.
Yeah, this has been great.
Really appreciate it.
Until next time.
All right. Take care. See ya.